join in as we get started, so we stay on time. Welcome, everybody. Today is our Women in Academic Medicine and Science Portraits in Innovation and Resilience series. And we are very fortunate to have a wonderful guest speaker, wonderful panel discussion. And so welcome to everybody. And then also welcome to those who couldn't join us but are watching the video. We're very happy that you're doing that. So I'd like to introduce Dina Moskowitz, who's going to introduce our guest speaker. Dina is a urogynecologist here at UCI and has been doing wonderful work here. And she was in our Women's Leadership Academy last year in cohort 1. And so I'll turn it over to Dina.
Thank you so much. So I have the privilege to introduce our speaker tonight, Dr. Karen Noblett. Dr. Noblett is the Chief Medical Officer at Axonics Modulation Technologies. She is a board-certified OB-GYN and female pelvic medicine and reconstructive surgeon. In addition to all of that, she completed her MBA at the Palmerage School of Business at UC Irvine in 2019. She's held numerous academic and healthcare leadership positions throughout her career. And she was previously here at UCI as a professor in the Department of OB-GYN and the Fellowship Director and Division Director for Urogynecology, as well as our interim Chief Medical Officer. She has also served on the American Board of Obstetrics and Gynecology Board of Directors and the American Urogynecology Board of Directors, and she maintains an academic appointment here at UC Irvine in our division of female pelvic medicine and reconstructive surgery. She's published over 50 peer-reviewed journal articles and authored multiple book chapters, and she's a recognized expert in the field of sacral neuromodulation. We are so lucky to have her here with us today, so let's welcome Dr. Noblett.
Thank you, Dina, very much. And it really is, seeing the women across the top of this, it's fantastic because it feels like coming home. So I've known, many of you or all of you for many years. And, Kristen and Amisha, I've known you guys longest, having worked with you when I was in practice at UC Irvine. So nice to see some familiar faces. And, I really want to thank you for the invitation just to come in and share my story and share my journey and how I ended up here in industry and, leaving my career in academic medicine. And so I know it's a smaller group, but, and Amisha, do you let me know how you want this to run, but I'd be open to taking questions during the talk as well. So if something comes up and somebody wants to raise their hands, then I'm more than happy to answer those questions.
And we can also have you guys put the questions in the chat too, and Dina and I can moderate that.
Perfect. And you told me I had about 3 hours for this, right? I'm just kidding. Everybody's hanging up now. So, if you were to had, called me or we talked maybe 6 years ago and you would have asked me, do you think that you would ever see yourself in this position? My answer would have been absolutely not. I was, I finished my fellowship at UC Irvine and I went into academic medicine, and that's where I saw my path. I didn't really see me departing from that sort of career trajectory. That's what, I identified myself with. I love the teaching, and I didn't really consider, that there were other options out there. I think that this was the path I set myself on, and I didn't really see myself deviating from that. But, just even taking a step back, when I first started college, I didn't really know what I wanted to do. I did come from a family. My father was a dentist, and so came from a healthcare family, but I just wasn't really set on what I wanted to do. But in the back of my mind, one of my thoughts was I wanted to be a winemaker. So, and I ended up as a gynecologist. So kind of a departure from that original thought. But the reason being was that my grandmother had 150 acres of grapes, and I love the agriculture. And so I stayed at Fresno State for my undergraduate, and I did that because it had only one of 3 enology programs in the country. But I started down this path of, organic chemistry and biology, and I discovered that, it was probably more of a romantic idea to own a winery versus making wine for somebody else. And, really ended up loving the chemistry and the biology, and had the opportunity to work with a cardiologist, and decided that was the path I wanted to take. So again, I got into medical school, got into UC Irvine, and that's a pretty easy to follow my career from there. So I did medical school, I did residency, I did fellowship. I escaped for 3 months, where I went to Indianapolis and did sort of a mini fellowship in electrodiagnostic medicine as it applied to the pelvic floor. And then I came back on faculty at UC Irvine, where I spent really the majority of my career, I think, as Dina had mentioned. And, when I started, people didn't know what a urogynecologist was. And I had to go around to all the different departments, introduce myself, and, basically educate people about what I did. And stayed on, as faculty for really the majority of my career. And when I escaped for that 3 months to Indianapolis, I got introduced to the idea of sacral neuromodulation. And this was a therapy that had just been approved in 1997. This was in 1998. And it was a pretty daunting surgical procedure for me as a gynecologist, because we were making this very large incision over the posterior aspect of the sacrum, which was anatomy I wasn't familiar with. But again, it's going to be kind of on that theme of like, well, I really kind of jumped in. I was so passionate about the therapy. I saw how it changed people's lives. And I adopted the therapy early on in my career. And I continued to, I think, take on some of the same challenges as they came along. So I took on this challenge of learning this surgery and becoming, the sort of the first person in Southern California that actually was performing this. And originally, when I started doing this, I was treating male patients because there was no male urologists or no urologists that were around that had been treating this. And so that was something that, I think, Dina, you'll appreciate this, when you're in the OR and you're not ready for your next case. I said, call for my next case. And the OR called back and said, does Dr. Noblett know her next patient's a man? I was like, yeah, I knew. So anyway, I started back and started the program, the Urogyne program at UCI. And shortly after I started, one of our amazing residents, Dr. Felicia Lane, came to me and said, hey, would you start a Urogyne fellowship? And I was barely 4 years out. And I'm like, I can't start a fellowship. I've just got out myself. But you guys know Felicia well. She is an amazing person. Everybody else wanted her, MFM, Gyn-Onc, and I couldn't say no. So I made her promise that she would stay with me as my first partner. And now she has taken over the division and is the vice chair of the department there, doing amazing things. So we started the fellowship program and really developed that. So I think, during my time at UCI, I started getting into more leadership positions. And I can remember David McGowa coming to me and saying, hey, Karen, would you want to be involved in medical staff? And I was like, I don't know, Dave. And he said, yeah, I think you should do it. So I, again, sort of jumped in and said, why not? Why don't I try it? I didn't have any background. I didn't have any training, but I thought it would be an interesting learning process. And so I went through sort of that trajectory in med staff, where you're secretary, treasurer, vice president, and then president of the medical staff. And I really loved those roles. I loved working with all the other departments. I loved that troubleshooting. I love the problem solving and all the other things that went into the med staff, and actually trying to combine, sort of the hospital entity with the medical staff entity, and bringing those two things together. So I really loved that process. At the time when I was finishing up my stint as the chair or the president of the medical staff, our chief medical officer at that time left, and Terry Belmont came to me and asked if I would sit in as the interim chief medical officer. And like I did for a lot of these things, when I got asked to do them, my first reaction was like, no. I don't have the training. I don't know, what I'm going to do. How am I going to be effective in that role if I haven't, gone to school for that, if I hadn't got a certificate? But I went back and I talked to my chair and I started thinking about it and thinking, well, what is the training for that? And what do you need? And so I took on the challenge and I went 50% time as the interim chief medical officer, and then kept my practice at 50%. And as you guys all know, that ended up being like 80% here and 80% here. So now you're working like 160%. But the other thing I found with that too, just like being on med staff, was I really love the process. I discovered so many of the resources that we had at UCI that I didn't know. And bringing together teams and doing this problem solving was very exciting for me. But I was a little bit late in the process when I decided, hey, maybe this is something that I would want to do for my career path. And, I had been, now almost, 17, 18 years into an academic practice. And it started me thinking about what's my next career step? Where do I want to be? But I was a little late in the process when I thought, well, maybe I'll throw my hat in the ring. They were down to the two final candidates. And I think because I doubted the fact that I could do the job or I would be the right person, I didn't really take that leap of faith. And I'm certainly glad that I took on that role, but things happen for a reason. I truly believe that. And in tandem to this, throughout my career, as Dina said, I got to an opportunity to become a board examiner, and then I got to sit on the AUGS board and the ABOG board. So in tandem, having developed some of these other opportunities in leadership, I think continued that thought process, or added to that thought process of, as I get older, what is it, that I want to be doing, and where do I see myself? So I had the opportunity. I was, recruited out to UC Riverside when they started their new med school, and recruited out to become the founding chair. And I really didn't have aspirations to become chair of a department. That wasn't really, kind of where I saw myself. But as you guys, are well aware, that's a very underserved population out in the Inland Empire. We were seeing, and you're probably still, you guys are probably all still seeing patients coming in because they don't have access to, healthcare out in the Inland Empire, and coming in to see you for, their conditions. We would see a lot of these patients come in, or they'd go to San Diego or UCLA. And I really felt that going out as a founding chair, I could develop a program with, a different vision, different priorities, and sort of a different thought process, and really make an impact on a patient population that was so in need. So that's what really spoke to my heart. And I think that's part of, my message is, when people are thinking about career paths, just spending some time understanding what makes you happy, what resonates with you, and saying yes to things because they fulfill what you want to do, not because you think it's going to make somebody else happy. It really should, be down to that thought process of, why am I doing this? What's motivating me? So I went out there because I thought, gosh, we can really develop this great program. We can, keep healthcare out in the Inland Empire. Patients don't have to travel in. And so I spent 3 years out there. We got a residency program started very early on. But, as life happens, it didn't really turn out as I envisioned it would. And I had been working with Axonics since 2014 as a physician consultant. And in my career path, I had worked with industry, both for research, and then on advisory boards, and in research and development for development of, surgical tools and products. And so I met the leadership at Axonics in 2014, and I'd been working with them. And as I mentioned, I got trained in neuromodulation early on, and it really became the focus of my practice, and really my clinical research. So probably more than 50% of the papers I published are related to sacral neuromodulation. And when I met the leadership team at Axonics, they started innovating in all the ways that needed to be innovated in this therapy. There were lots of challenges, lots of barriers. And so it was very exciting for me to start at the very beginning. So when I met the team, they did not have a product. And what was really different than other medical device companies that I'd worked with in the past, where they would take a product and have the engineers develop it with what the engineers thought was cool, and not talking to physicians or to patients. And so what Axonics did was something very different and really took a customer-centric approach. And so before we developed any product, we got together a 25 group physician advisory board, and we gave feedback to the company about what we liked about neuromodulation, what were our unmet needs, what were our pain points. But importantly, they did this with patients as well. They brought patients into the office with focus groups that were patients using remote controls and using rechargeable devices, and got feedback from those patients about what was important to them, what were their unmet needs. And that's what informed the product that we have. And I love that process. And I got to be involved with sort of that product development from the very beginning, with that focus of being customer-centric. And that's how I always approached my practice, was being very customer-centric when I took care of an individual patient. But the theme of this is that, when I got into med staff and I got into the chief medical officer role, and then in some of the other leadership roles, it was impacting more than one patient at a time. And in clinical practice, as much as I love taking care of patients, I love the teaching aspects, I was wondering what was next. And having a taste of being able to impact more than one person at a time really spoke to my heart. So I was, being recruited to join the company. And of course, you can imagine what my first reaction was. I was like, no way. I'm happy to, be involved and be a physician advisor to help with the research. But my blinders were on, right? I'm going to be academic medicine. I'm not deviating from the path. And that's where my identity was. And I had a hard time thinking I would ever depart from that, especially going into industry. But again, this process was really something that I was excited about. I got to see the innovation. I got to be part of it. And it was a therapy that I really embraced. I love this therapy. I love what it does for our patients' quality of life. And then when I was honest with myself, and this was, I think, the biggest factor, tried to take my ego out of it and was quiet. I meditate. I did a lot of meditation on this. And I challenged myself to really be true to what was going to make me happy. When I thought about my next 5-10 years, what was the answer to that question? And if I was true to myself and honest with myself, it was really being involved with this company as the chief medical officer. So I took a big leap of faith. Again, we were not publicly traded at that time. We did not have an FDA-approved product. I joined the company when we started our clinical trial, but I was so passionate and I felt so strongly that I wanted to reach more women with these conditions for urinary and fecal incontinence, because these patients are, again, not raising their hand. They're not coming forward. And being able to be part of a movement where we can expand the awareness and expand the indications really spoke to my heart. And so now at the company, I get to do all the things that I love to do as a fellowship director, which is to teach. So I'm I have the whole medical education department. We put together a fantastic medical education program. And then research. So I'm in charge of all clinical affairs and all of our research efforts going forward. So it's been a fantastic, I think, career move for me. As Dina said, I've had the opportunity to keep my academic appointment at UC Irvine. So I get to come in and work with the fellows and occasionally come into the OR. I think I'm going to be in the OR in the next couple of weeks with Dr. Lane. So that's really fun for me to still be involved. As I mentioned, we just did our first fellows course, and that was very exciting. So I get to be really involved in the education, of our future leaders going forward. So with that, I think that I've probably rambled on quite enough, but I'm happy to answer any questions. I don't know if I got to all of the points, but it really is, I think, being open-minded, having your moral compass about, where you're doing and doing things for the right reasons. And, one of my favorite books is Simon Sinek's Start with a Why. I don't know if you've read that, but always keep that in mind when you're thinking about what you want to do next, or if you're given an opportunity to do something, be true to yourself and ask, what's my motivation? Why am I doing this? And is this something that, is going to feed my soul to make me happy? Or am I doing it because I think I'm going to make somebody else happy? And so those are some of the sort of the central tenets, as well as not being afraid to say, yes, I want to try it. You may not have all the skill set at that point, but probably nobody does. And, if it feels right, it's something you're interested in, take a chance, and see what, you might find about yourself, and kind of maybe some of the next steps. And I guess the last thing would be, a lot of things aren't on our radar screen. So don't be surprised. Don't think you have to have everything planned out, and be open to kind of those opportunities that may come your way.
Karen, that was it's amazing to hear your story, your career path, because I think what really resonates is like, you took a lot of chances early on in your career. And I guess I have a question as we wait for others to ask is, how did you develop that confidence or have that leap of faith to do it? Because many times nowadays, everyone's very cautious because everyone's overworked and there's so many things to do. How did you develop that, or was it just innate in you? I know it's a very esoteric question, but we have a mixed group of faculty here today, so that may help all of us to kind of get that confidence to say yes to some of those roles that we're not thinking about.
Yeah, and I will give that credit to my mom. My mom, I think she had wanted to go into medicine, but she didn't have that opportunity. She became a teacher, and then she retired to raise us. I have an older brother, younger sister. But my mom made me feel like I could do anything. She gave me that confidence. She, encouraged me to do things. She encouraged me to take chances, so that I didn't feel afraid. I didn't feel afraid to fail. And that's another really great book, if you guys can read it. It's called Mindset by Carol Dweck. And it really is about that fixed mindset versus the open mindset. And I think that she instilled that in me and made me feel like, she empowered me to feel like I could try different things. And that, I didn't have to be afraid. I mean, I played Little League. I was the only girl on an all boys Little League team. I mean, that's, she was like encouraging me to get out there, and she'd come watch all my games. And that just continued, I think, throughout my career, is that was instilled early on. And I think having really good mentors, I think really is important as well. And, some of those tenets I spoke about, I will say that one of the best pieces of advice I got was from Dr. Desaya when I first joined the department. He said, don't sign up for every committee people ask you to sign up for, because they'll overwork you. So pick the ones that you really resonate with. So I would just say, don't overextend as well, just because people are asking you to do that. But think about, consciously think about, is this something I want to do, and why do I want to do it?
We have a question in the chat from Dr. Kolali. She asks how nowadays a lot of young physicians are turning to life coaches as consultants or professional coaches. Do you have any experience with that? And then you did mention how you had mentors in academia, but did you have any physician mentors in industry? And if yes, how did you find them?
Yeah, I think, the life coaches and the wellness and the, work-life balance is really important. Early on, I was very interested in alternative medicine, holistic medicine. And, when I was in undergrad applying to medical school, one of my advisors said, don't mention that in your interviews because you'll not be accepted, because it was so like voodoo at the time. So it's been something that I've been aware of. And we all struggle with that, but my wife is a wellness person. And so, this is something that we incorporate into our lives and really pay attention to. I've been meditating now for probably 12 years, and that's made a huge difference. And I think finding some of those things that can work for you. When you talk to a life coach or a wellness coach, it really is finding the things that you can do. And we're all so busy, but there are definitely little things that you can do every single day to kind of bring you back and to kind of, center yourself, and making that a priority. And did that answer that question?
Mm-hmm.
As far as, I think most of my mentors were in academics, as I met the physician mentors, and they weren't just at UCI, but, they were, as I got into the ABOG board and got involved with OGS and developed those mentorship, relationships as well. There weren't a lot of physicians that I encountered in industry. It was really, a lot of engineers, a lot of marketing people, education. And it was really quite taboo. I think, people were, you're going over to the dark side. There's always this negative connotation about, working with industry, but it really is a balance, because when you think about, well, who do you want advising these companies? You want people that know the therapy, that, love the therapy, that are motivated for the right reasons. And, that's going to inform the best products that are going to come forward. And so I really did. I mean, I had to do an ego check when I did this. I will fully admit, I talked to many of my colleagues who I considered, dear friends, and that would give me honest feedback. And I'm like, what do you think? I mean, what are people going to think of me? That, of course, that's part of the calculus when you're thinking about making such a big move from academic medicine into industry. But people knew that I had worked with industry in the past throughout my career, and I kept it, I kept my integrity about it. As I said, you just have to have that moral compass and doing things for the right reason. And so the feedback I really got was, you're the right person to do it. You've been involved with this therapy, you're passionate, you've published on it. You're the right person to do it. And I finally got to the point where it's like, I can't worry about what other people think about me if I do this. The people that really know me know the motivation and why I did it. And the people that don't or want to judge me, that's okay. They just don't know me that well.
Thank you for that. I was going to now open it up also to everyone to ask questions, then also open it up to Dr. Kelly. Kristen Kelly has joined us. She's our other person on our panel today. She's currently the chair of dermatology. And I was going to ask her to say a few words, and maybe if you wanted to mention, Kristen, answer that last question about coaching and mentorship for faculty, since you are running that right now.
Well, first of all, Karen, I just wanted to thank you for, sharing your story. I mean, it's very impressive. And I was fortunate enough to get to see you and work with you a little bit earlier in your career, and was always very impressed with you at that time. And, this just impresses me even more seeing, your story. And as I was thinking about it, a couple things came to mind. One was that, you took opportunities that came to you. It seemed like, a lot of the time, it wasn't that you had planned, many of these things, but then opportunities came up, and oftentimes opportunities that didn't seem like they were going to be the right path maybe at the beginning, but you were open to looking at it. And I have to say, in my career, I think that's something too. I mean, there are a variety of things that I've gotten involved in that, had you asked me 20 years ago, would I have done it? It was not what I was thinking. And if I had planned out my career, it wouldn't have been there, but it's really taken me, being open to things has taken me to a path that I have really enjoyed. And that includes even being chair. Had you asked me, was I going to be chair 20 years ago? That was not what I was thinking. It wasn't something I planned out. But as opportunities came up, it kind of led me to a path that ultimately ended up being chair. And then the other thing that I, heard, which I guess comes into the question that was asked, is I think that along your way, you had a variety of mentors that seemed like they could have been important. I think that, mentors and I'm going to say superiors, but, chair, if it's in an academic department, or, someone else in the company, depending, can be very important in terms of, helping people find opportunities, making connections with them. And so I think it's very important. And those are the kind of people you want as your mentors, those people who are willing to help you, but also, if a mentor is always, for example, in academics, if a mentor is going to be on every paper that you're ever on, ultimately that doesn't help you, because you have to be able to establish yourself as an independent scientist, et cetera. And so, so someone who's going to help you get opportunities, help you make those connections, and then let you do that yourself, and, kind of take themselves out of it so that you can have those opportunities. So I have been very fortunate to have some mentors like that. And how I've come across them, it's varied. Some of them were obviously a chair in a department or something, someone who was kind of set up to be my mentor. But then I've also looked for people who I admired, for people who I thought had similar values, or that I thought I could really learn something from, and then, reaching out to them. And, not all of them have been at UC Irvine. I've had some great mentors at UC Irvine, but some of them have been across the country or across the world. And so either as mentors and or as collaborators, I've been very fortunate to work with some really outstanding people, not outstanding scientists, outstanding clinicians, but just outstanding people.
Kristen, I'm glad that you mentioned that, because, mentorship is always an interesting thing. And we try to get away from assigning a mentor, because to me, the mentorship is, it happens sort of organically, right? You come together for specific reasons. But I think even on top of what you mentioned was, it's one thing to be a mentor, but also we should be active in sponsoring our younger, faculty that are coming through. Kind of like you said, let them go on their own, find their niche, and help them get those connections and get those relationships, and write those letters of recommendation for them, encourage them to get out there. So not just being a mentor to guide them, but be, taking even more of an active role in helping to sponsor them to advance in their careers.
That's a term we've been using a lot more, not just mentorship, but active sponsorship, really helping, letting people choose their path, but then helping them to take the next step that will help them get where they want to be.
Mm-hmm.
All right, so I think Dina has a question for the both of you.
Thank you both so much for sharing your experiences. We've talked a lot about mentorship. I'm wondering if you guys have any tips for those of us earlier in our careers on maybe how to be the best mentee, and how you think you can be most productive from that role of the mentorship relationship.
Kristen, why don't you go ahead and go first?
So in terms of being a mentee, I mean, I think a couple things. I think don't be afraid to ask things. I mean, honestly, you should hopefully be able to ask your mentor, most things, and hopefully they'll give you an honest answer. I think that and it may not always be the answer that you want, to be honest, because hopefully, again, they'll be honest with you. But then, also know that, any mentor-mentee relationship is advice. And so, you have to kind of determine which portions of that are right for you and then kind of run with it. I think you don't have to have only one mentor for sure. And so I would definitely keep that in mind, that again, and it can be multiple people and doesn't only have to be the obvious mentor for you, those who are kind of like right above you, but, certainly I think reaching out to people really, again, all over the world, because now we have Zoom meetings, right? So, right now I have probably 5 or 6 faculty members across the country who I meet with, who are not only at UC Irvine, but, because of common clinical interests or something like that. And so, we meet quarterly or every other month or something like that. And so there's no reason you can't have a Zoom meeting with literally anyone around the world. So I think there are a lot of opportunities there. And then making sure, and I hope this would always be the case, but making sure that you really feel that your mentor always has your best interests at heart. And I think the majority of time mentors are, but there are times when perhaps you need to adjust the relationship a little bit if they're not, giving you the opportunities and letting you grow in the ways that you need to.
Yeah, I think those are all really excellent points. And I would add to that, if you are asking somebody to be your mentor, make sure you follow up with them. Make sure that you schedule time and then discuss with them what's the best way to contact you. And if they, you sit down, they give you some advice, you may not take that advice, but let them know why, that feedback, or if you do, give them the follow-up. Always expressing, gratitude is really important in everything that we do. But I think in that situation as well. And then like Kristen said, be open to mentors that you may not have thought were going to be your mentor. And, if you feel sort of an attraction for something this person is doing, or you feel there's some, you resonate with that, or there's you identify with that, kind of explore that, even though it may not have been somebody you thought, would be that logical mentor that is going to do, some research with you. It might be a life mentor. It might be somebody who you really respect in the way that they conduct themselves or they speak, or and maybe have a specific goal for that mentorship.
You both mentioned sponsorship. So how does someone early on in their career find a sponsor, or does it just happen organically?
I think it can happen both ways. And I think if you have a clear idea, and as a young faculty, you may not have a clear idea of exactly what that is. Again, you may not see that radar screen, but if you have a sense of like, I'd like to be in some leadership roles, or I'd like to do NIH research, having some sort of that path, and then finding somebody who's been successful in that area. And they may not be per se a mentor for you, but they may be that person that can connect you and can lead you down the right path and share their experiences. And it's always so good to learn from people and what barriers they came up against, where they failed, so that you don't have to sort of make the same mistakes. So I would differentiate that just a little bit, but it could be a mentor that you then actually becomes your primary mentor that you stick with, and that has the ability to help you get to that next step in your career.
And I would completely agree with that. I think oftentimes it will be a mentor, but again, the mentors that I think can be most beneficial to you are those who are going to be looking for opportunities for you. Of course, you want to look for your own opportunities as well. But, if there's a society that you think, gee, I'd love to be leadership at some point in that, or there's a new subspecialty area, or whatever it is, someone who can look for those opportunities for you, and hopefully who has connections in that realm, who can then really help you to and the willingness to promote you. And so I think that is very beneficial. And so again, I think looking for a mentor who's going to take it to that next level and sponsor you for these things is very helpful.
I don't know if anyone else has a question. Or I have another question. The other question I wanted to ask you was, how does someone early on in their career get involved in industry? Like, what's a way for someone who's, on the academic path like you were, and then to do advisory boards? How do you get invited to those things?
Yeah, so I have a funny story. When I came on as faculty, I had a research idea, and I didn't have any research money, no NIH funding at that time, and so I learned about the industry sponsored trials, and went to their clinical affairs site, and this was with Boston Scientific, and I said, I want to do this study, and so I just submitted an application, and I got it. It was like $75,000 or something, not that much, but I took they sent me a check to me, and I took it to our finance person. I said, "Oh, Gail, look what I got." She's like, "What did you do?" So that's not the way to get involved. But I thought you just ask for the money and they give it to you. But I think it was, for me, the genesis of it was research, and getting involved with that research and becoming sort of an expert in that therapy. And the companies come to you and ask you, can you help us with the next iteration of the product? Can you review the R&D? Can you be a proctor preceptor for us? And so it started there, and I think it has to be something where you really believe in that product. Like I worked with one, company that did slings and pelvic prolapse. I wouldn't then go and work with, 3 or 4 other companies. So really having that credibility even within industry is really important. So for me, it started with research, and then I just was curious. I would ask questions. I would, get to know the leadership there. And just like with the other opportunities I took, when opportunities came, I took them. If it felt right, I said, yeah, I'd love to get involved. I'd love to be on the advisory panel. I'd love to help inform, the next research design that you're going to do. And so I think having some expertise in a therapy and a product, expressing interest, because this was something that the Society of Women in Urology, Dina, you probably might be aware of this. One of the initiatives they had is how women in urology can engage more with industry, because it seemed that, all of industry were going to the male urologist. So what was the whole saying? No more manels, for the panels being all men. Sorry for the males on here, but this was so the women in urology were speaking up and saying, how can we get more involved? And so it's really all of these pathways. Some institutes are very restrictive and all you can really do is research, and others like UCI, you can get more involved, and you can be involved in the innovation and the research and even the speaking, for these companies. It was probably a little bit easier back in the day when, I was younger in my career, but there's still opportunities to get involved, and companies are really looking for, physicians who have a lot of credibility and are really doing things for the right reason.
Thank you for that. Does anyone else have a question? I was actually going to switch gears and ask kind of a more of light question. What do you guys do for fun?
You want to start, Karen? You start.
Okay, well, I love to travel. So I just had my 60th birthday, and I got to take a bucket list trip. We went to Ecuador and spent some time in the Amazon, which was amazing. I never would have thought to go on the Amazon. The primary goal of the trip was to go to the Galapagos, as a biology major, Darwin, all of that. But it was a pretty active trip. We did it with back roads. And so part of it in the Amazon, part in the Andes, and then the Galapagos. So that's what I love to do. I love to hike. We have 3 rescue dogs, so spending a lot of time with them. And I have 2 grandkids now, almost 5-year-old and a almost 2-year-old. And they are just like the joy of our lives right now. So
well, maybe a little bit repetitive, but travel is also, my favorite thing to do. I have 3 daughters now who are kind of spread across the country, pretty much as far away from me as they can get in the United States, one in Miami, one in Boston, and then one in Indiana. And so, visiting them, but then also trying to find opportunities where we can go to exciting places in the world and experience it together. So I really enjoy that. And then I try to, during the pandemic, it helped me to kind of, I guess, rethink about things a little bit. And so I was not very good. In fact, I was terrible at, exercising and making sure I had time to do things like that. So that really made me rethink things a little bit. So I try to get at least 30 minutes of something. And I know 30 minutes is not very long, but, going out for a walk, and sometimes it's at 8 o'clock at night, but, I'm in a safe place so I can do that kind of thing. Or I also, will just do a class at home or something like that. So 30 minutes of clearing my head. It doesn't happen every day, but I hope to do it at least, 80 or 90% of the days. And that helps me to rethink things.
I think both of you guys focused or talked about wellness and how important it is in a physician's career. And we hear a lot about it. And, at an institutional level, there institutions and schools and organizations are doing a lot. What do you guys recommend to do, like, at an individual level?
So what I just meant, I try to do that. I also try to do, 10 minutes of just kind of, you could call it whatever you want, but meditation or kind of rethinking over my day. And sometimes I'll think about things I wish I had done better with. And I'm not always so good at this, I have to be honest, but, I did have a coach for a little while. And one of the things they said is, yes, it's good to look at things you could have done better, but also think about the things you did well. So make it also a positive experience for yourself, that these are things that I thought went well and that I could build on or that I could do again, kind of thing. And then I think also, I think it's different for different people, but I like to connect with people in various ways. So, finding, friends that you can go out with, or again, traveling around to, meet with my family, et cetera, it helps me.
Yeah, I would echo that and think about sort of some of the 4 pillars, for wellness. I think you hit an important point, and, like exercise or movement. Some people don't want to hear the term exercise, that turns them off, but some kind of movement. And I used to be a big time runner. And, if I couldn't get an hour, didn't have an hour to work out in, I wouldn't do it. And so I got past that. And that was the big thing for me. So like you said, maybe only 30 minutes. 30 minutes is better than nothing. 30 minutes is great. And so, when I was I'm still traveling quite a bit, I made a commitment that I'm going to do something, even if I can get 10 or 15 minutes, that is going to be better. So having some type of movement, and then, spirituality is really, important, in that laughter and, that joy, and expressing gratitude is a big component for me. So every night I have a gratitude journal. So I'll write in that about the things that I'm grateful for. And, sometimes I'm repeating myself again and again, but it really level sets you at the end of the day to get you, kind of in that space. And then the stress response management, that's a huge factor for all of us that are so busy. And that's going to be different. I hear people say, oh, I do this exercise, and that's even another level of stress on your body, but actually, kind of that introversion, like you were talking about, Kristen, and as I mentioned, I started meditating. And so for me, that's that time of, really, kind of letting things calm down. And what I do is transcendental meditation. I tried so many other types of meditation that I couldn't do. And when I learned TM, that made all the difference. And so it is it's something that really worked for me, but you just find something that works for you on that level. And then sleep and nutrition are so important. So, those lifestyle kinds of things to take into consideration. And the one thing that I still really struggle with, that I really need to work on, is getting enough sleep. So, I mean, we talk about this, but, I'm certainly not perfect at doing it. I have the concepts, but, still have to work at it.
Well, I want to thank both of you. Unless anyone else has any other questions, I wanted to thank both of you for coming and spending time with us and sharing your stories. Both of you guys have very inspirational stories and journeys, and I think a lot of good lessons for all of us to take, no matter what level we are in our career. And I think a lot of that resonates with our whole group here, especially with, I think thinking about taking that leap of faith and sometimes saying yes to opportunities, I think is really important, as you mentioned, Karen. So thank you both very, very much. And thank you to all who attended. We're very grateful that you guys could all join us today as well.
Well, thank you for inviting us. And I would say, Colleen, definitely go to the Galapagos. I saw that's on your bucket list. You won't regret it. It's a pretty amazing place. But thank you so much for the invitation. And allowing, us to share our stories. And I'll just, put it out there that if anybody ever wants to get in touch with me, Dina has all my contact information, I'm sure. And Amisha, you have I think my contact information, but please feel free to reach out if you have any questions just about this whole process. I'm more than happy to, spend some time.
Thank you so much. Thank you, both of you.